Well, Dr. Rutledge, it's great to meet you. Thanks for joining us on the program this morning.
I appreciate the invitation.
You can't go anywhere without on a streaming platform without getting some ad about Wegovy or Ozempic or some other weight loss drug. A lot of people are now taking them. A lot of people are focused on losing weight. But, doctor, there is a dark side or an unintended side to the weight loss.
There is indeed. There's, I think, what you could call a neglected psychology side. So, as you say, yes, we're kind of entering a whole new world. It's very exciting. Opportunities that were restricted to things like bariatric surgery in the past are now becoming available to tens of millions of people with far fewer barriers. But most of the emphasis, most of the advertising, of course, is on the weight loss, the metabolic health benefits, the transformative health effects, and those are very real. But what they fail to provide much attention to is that, there's a human being on the inside of that rapid transformation. And we don't necessarily have a lot of experience with how the mind and the emotions react when a person is going through such dramatic change in a short period of time.
I remember the Biggest Loser. That was a big show. And there was a follow-up documentary, I don't know, 5, 10, 15, 20 years later. There were a lot of psychological barriers that these individuals covered. Now we can have weight loss in a few months. I think that was like a game show where people would exercise and over 6 to 12 months they would lose the weight. Now you can lose it almost instantaneously. What's the mind body connection? As you said, that's probably pretty overlooked, but our mind, our mental health is just as important as our overall health.
Right. And most people think that there are sort of two sides of the same coin. But in fact, even though they are closely related, there definitely can be a gap that the mind kind of evolved to give us a sense of stability about who we are. And when you think about most people's life experiences, when they've had physical changes, when their body has changed, and so we think about aging, for example, it happens slowly, gradually over the course of years and even decades. And this has been true throughout human history. It's relatively rare to have dramatic, sudden physical changes. So the brain sort of evolved to give you a stable sense of self. And then it's only in modernity, really in the last few decades, where we've developed cosmetic surgeries, bariatric surgeries, GLP medicines, things where all of a sudden, almost out of nowhere, within a few months or even sometimes a few weeks, depending upon the procedure, a person can have these dramatic physical transformations. And it does show that there can be this gap, this mismatch between how the brain sees and experiences the body and how the body might really be. And so phantom obesity is really just an example of that. The body can be very different objectively on the scale, clothing sizes, how other people see you. And yet you might still see and experience your old pre-weight loss body.
Yeah, I'm thinking about like body dysmorphia. Again, I am not a clinician. I'm just a layperson, but of course, we get bombarded by news and information all the time. But you could lose all the weight, doctor, but still think that you're out of shape and you don't look good, right? I mean, you could go through this process, but still have this perception that I got a little bit over here and I got to get that off, or maybe I need some liposuction or something else, right? So there's that perception that really isn't grounded in reality.
It often lags behind. And there's many examples of it. So phantom obesity is really just one example of many flavors in which this can show up. Most people, for example, have heard of what's called phantom limb, where a person might lose a hand or a foot through an accident, and yet might have a very strong psychological and even sort of visceral experience that that limb still exists. They know it's not there. They can see it. Their doctors can see it, but they can feel it, experience it. Similarly, after cosmetic surgeries, a person can have their face, their nose, their eyes changed in some meaningful way, but it might take months for them to still see it. You mentioned body dysmorphia. There's people who engage in activities like bodybuilding where they might gain a lot of muscle, but still see themselves as much smaller and thinner. So once again, this phenomenon, this gap between the mind and the body can show up in many different ways.
So if I'm prescribing this medication, I'm a primary care physician. Should I make a recommendation that you the individual who's receiving that advice and receiving the medication, they should sit down and get some counseling because to prepare themselves during and after what they're going to look like. I mean, is that what's necessary here to make sure that you don't regress, that your mental health doesn't suffer as a result of this big change? Because you have this anticipation, this expectation, but maybe you're, mentally you're not in alignment.
My professional opinion is absolutely, and this is grounded in, say, I've spent about 20 years working with bariatric surgery. And anyone who's been through bariatric surgery knows that psychology evaluation and education has been part of that process since the 1990s. So very early on, say 30 plus years ago, kind of the collective field recognized that bariatric surgery is way more than just a physical procedure, that there is profound emotional, psychiatric, social effects, and that building psychology into that process is really important. I'm hoping that as the GLP revolution goes on here, that this will play out in a similar way. It's because on one hand, you can say, well, yes, the simplest solution is simply to have the medical provider uh, offer that support, that education, but that's often unrealistic. You just can't expect prescribers that will have the knowledge, the time, the frequency of the visits. So ideally, we would over time develop a process, at least in my humble professional opinion, that mirrors in many ways the bariatric process, where psychology is kind of built in right from the get-go, and then there can be some education up front and some resources that are provided for people who need it.
Yeah, I would tend to agree. And not being a clinician, not having a dog in the hunt, so to speak, I would, if I was going through that process, or really any, even if I had a disease, say like cancer or heart disease or something that required surgery or some type of intervention, I'd want to sit down with someone along with my loved ones to make sure that I was processing things correctly because the emotions often can get skewed during these type of events. But doctor, are you a little bit more optimistic though? Because I feel like mental health has really become more of a more of a important topic these days. I mean, I go to my primary care physician, they ask me about my mental health. So does that lead you to have a little bit more optimism when it comes to this GLP-1 revolution that we're undergoing?
I think you make a good point, and I'm hopeful that what you say is true. That
Yeah.
kind of there's been a constellation of stars over the past few years where the stigma about mental health treatment has lowered, and so I think there's a larger percentage of people who are willing to engage in those conversations than before. And then plus with the advances in technology, it's easier to access those kinds of treatments. It doesn't require going to a psychotherapist office or seeing a psychiatrist, that you can do things remotely. Uh, Obviously, AI will be adopting some mental health outlets and can provide education and support, at least on some level. So I think there will also be a growing number of opportunities, as well as lowering stigma. And the combination of those could be really useful for the much larger percentage of the population that's, say, going to be using GLP medicines compared to, say, old-fashioned bariatric surgery.
And GLP-1s, my understanding is some of these are covered by insurance, but mental health treatments, most insurance companies, want to get your reaction to this, or at least my correction to this. I think most insurance companies recognize as well that mental health is important. So as you're getting approved for GLP-1 or some type of surgery related to your weight, you probably could look up whether or not you can get counseling.
That's right. For example, in the bariatric surgery world, insurance companies even formally require a person go through a psychological evaluation. Now, they don't require therapy or ongoing treatment or anything to that degree, but the insurance companies themselves have seen the data and said, hey, we need to make this policy. And so that actually came from the insurance companies rather than from the clinicians or the patient populations. And again, I know there's all kinds of insurance complications. That money is the primary elephant in the room when it
Yeah.
comes to people getting GLPs these days. But yeah, but I'm hoping again, as the science continues to evolve, that we will be developing these policies that are friendly to patients that are using them, the clinicians prescribing them, and the insurance companies that might be footing part of the bill to sort of formally build in at least some kind of a psychology piece.
Yeah, well, I think people we often overlook things that we're not familiar with. The emotional and psychological impacts is just one of those things. Dr. Rutledge, we're going to have to leave it there. Great article, great piece. And look, we look forward to having you back on the program again very soon, sir.
Again, thank you for the opportunity.
Well, thanks for watching. And don't forget, we're back again tomorrow morning